Abdominoplasty is the medical term for a tummy tuck, which basically it is an incision in the lower abdomen, elevating basically the flap of tissue, and then all the way up to the xiphoid, this area of the sternum, and then basically plicating the rectus abdominis muscle to the position that they were originally, to the anatomical position, and then basically removing the excess of tissue, creating a new umbilical belly button. So that is the typical tummy tuck.
Are some people better candidates than others? How do you choose a candidate?
Best candidate? Well, usually candidates are women that have children and had children, and they had weakness on the abdominal wall, the diastasis, right, the separation of the muscle because of childbirth and carrying a baby for 9 months, and excess of abdominal or skin, excess of lower abdomen skin, stretch marks. So those are typically the candidates for tummy tucks. Now, you could have somebody who have never had a child, and because of rapid weight loss, might have flaccidity or excess lower abdominal fat and skin that will be candidates for this procedure.
One of the great things about having the tummy tuck done with Dr. Perez is my self-esteem. Everything in my life is better and brighter and more happy. Every single day that I wake up is never the same ever since he's touched me. Not only do I look better in clothes, I feel better, my sex life is better, everything that you can possibly imagine. And also, it was a cost savings for me. Prior to coming and having my tummy tuck done with Dr. Perez, I spent thousands of dollars with chiropractors, acupuncturists, massage therapy, and once I got rid of all my belly fat, that has completely gone away. I've not gone to any more chiropractors, no more massage therapists. So in my mind, not only did I save money by having the tummy tuck done, I've also prolonged my life. And that's important.
In males, will be male patients that have lost significant amount of weight, and then they have excess of skin and fat in the lower abdomen that might even interfere with activities of daily living, or simply they're not very happy with the appearance of their abdomen.
What's the procedure like? Describe the process for you.
Usually do is lipoabdominoplasty, which is basically includes liposuction with this tummy tuck. And the reason I do that is because if you simply do a tummy tuck, what it does, it makes patients look more square or cylindrical. The body shape is more cylindrical, so that's where liposuction will change the shape of these patients. Instead of being cylindrical after an abdominoplasty, if you add liposuction, you will get a more curvy looking, better looking results.
Is it possible to do a tummy tuck right after a C-section?
Yeah, it does remove the stretch marks that are at the level of the belly button or below, but not above. So those stretch marks above the belly button will still be there, but they will be lower in the abdomen.
And what about a hysterectomy?
Some surgeons do that. I don't do that. And the reason is the uterus is large. So whether you close this, you do a plastic suture closure, and you probably the incision looks okay, looks better, but you have a uterus that is enlarged, so that tissue, you won't be able to remove that much tissue. So, but if you wait 9 months or a year, then you'll be able to remove a lot of tissue. The results are going to be better.
How long is the recovery process?
Typically, it's about 2 weeks.
And would a patient have visible scars?
Every time you have surgery, you have visible scars. The scars, and this is a good point. The scars in a lipoabdominoplasty, basically now is really, when you look at pictures of people who have had like tummy tucks years ago, 10 years, 15 years ago, we're doing much better with the scars. Actually, when you look at the scars right now for a full abdominoplasty, they look almost just as good as the small lipoabdominal, like a mini tummy tuck, or simply just a little bigger than a C-section.
I had a very huge, large, fatty mass in my belly. Also, one of the great things about him is he made sure I was at an accurate body weight to make sure that I could have this procedure done and be safe about it. And ever since I've had it done, which is about 3 years ago, I've been able to maintain a great body weight, understanding that now I have more muscle than I do fat, which is a huge thing. Belly fat is one of the most deadliest forms of fat within your body, and that is so important to me. So when I look at the procedure that I had done, having a tummy tuck done with him, I look at it as, one, it has actually given me longevity to my life because of the body fat being removed from that particular area. And also, he's just so incredible with his procedure. I literally, the very next day, I walked in here by myself. Also, I think there's a very big mind-body connection. It has made me be a completely different person with my self-esteem. Before, I was very ashamed of myself, held my head down. I walk with my head high now. I feel confident. I feel beautiful. I feel sexy. I look better now at 46 than I've ever looked in my entire life.
Lipoabdominoplasty essentially is what it has done for women nowadays is this incision is very low. It's about 7 centimeters, 5 to 7 centimeters from the labia commissure, which is very low. So now essentially women could go and wear bikinis and still not be able to see the scar of the lipoabdominoplasty.
Health Matters will be right back.